Massage, what is it, and why should people have it as part of their healthcare plan? Massage therapy is essentially the manipulation of the soft tissues of the body. Through touch, a therapist can affect every system of the body through the nervous system. It can also be used to help treat mental and emotional disorders, again through the nervous system. Now, as far as a medical treatment, massage has existed in human history and medical treatments since about the dawn of mankind. Almost every major society has developed some form of touch therapy, whether it be the Indians with Ayurvedic medicine, which uses lots of oils, to the Chinese medicine, which uses acupressure, to Swedish, which uses petrissage, which is a kneading stroke, effleurage, which is a gliding stroke, friction strokes, and simple passive touch. Through the course of history, mankind has found that the simple act of touch is healing in and of itself. It is so powerful that it has been found that in premature babies, those that have been touched put on body weight much faster and actually have a higher success rate and actually are more likely to go home with their parents as opposed to not making it. Massage is throughout our medical system, whether we realize it or not. Physical therapists use it in treatment of joint injuries. We even have surgeons using cardiac massage to help keep hearts beating and keep blood flowing throughout the body. Because the nervous system affects every part of the body, this is how the massage has become so important to us. The nervous system connecting to everything in the body, especially the skin, which is what a therapist directly contacts. Through that contact, we can elicit either a sympathetic or the flight or flight response, or a parasympathetic, the rest and digest response. Either response is appropriate depending on what the situation is. For a pre-event sports massage, the therapist wants to get the blood flowing, wants heart rate up, wants breathing to be increased. They're going to use vigorous massage and initiate that sympathetic response. However, most massage is actually attempting to elicit a parasympathetic response, which is our rest and digest. In our rest and digest, or parasympathetic response, our food is digested much more quickly. Our stomach produces the mucus lining that keeps the acid from eroding it much more efficiently. Our body releases its defense mechanisms. Fibroblasts, which are the little cells in our body that go to sites of wounds and actually will knit together the flesh again, are released during a parasympathetic response. Blood vessels relax. Blood flows slower, and therefore it has more time to act upon the other bodily tissues. Further, our respirations, while they slow, we take deeper breaths and we actually receive more oxygen that way. Now, because of this, we actually can activate the muscles, loosen them, or tighten them. One thing people don't realize, though, about muscles is they have a true memory, not just in action, but emotions. Massage therapy, when it releases those muscles that may have been held tight for years, decades, we can actually release emotions that have been held inside the patient or client for as long as they can remember. Particularly strong emotions are grief or sadness, which reaction may be elicited during a stomach massage, because that's a common storage site for these emotions. All this is very important for a competent massage therapist to know. And because massage affects all parts of the body, it is almost vital nowadays that a therapist be part of any healthcare team. While a therapist is not a doctor and cannot legally cure any disease or pathologies, they can be effective parts of the treatment plan and can actually achieve a state of complete remission. I recommend to everybody that if you have any sort of muscle issue, talk not only to your doctor, talk to your therapist. I hope you've enjoyed this speech and you have a great day.